What's up, guys? Dr. Mo here, Mohammed Ashori MD. I am a board certified family medicine doctor. So here we go. Let's go through some questions. Let's see what we got. Ask Docs. This is Reddit, reddit.com. The way it works is there's these little subgroups where people get together. The most common thing that everybody does is give clever answers, and I think that's the thing these days with comments. Everybody tries to be as clever as possible. So let's go through it. Should I get the rabies vaccine? Possible bat bite. The general answer is yes. If you suspect a bat bite, you should be getting a rabies vaccine. 2 nights ago, I woke up in the night, something in the room. I rolled over in the bed and the bat flew straight into my face. Yeah, basically, if you found yourself overnight sleeping in some place where you could have been exposed to a bat bite, bats do carry rabies at a high enough rate that getting the rabies series is a good idea. Don't worry, they won't give you any injections into your stomach, despite what you heard. So that's a good thing to do. Get to the ER and get the rabies vaccine series. The short-term and mild discomfort of the vaccine series is nothing compared to the absolute certainty you will die if you contract rabies. I wouldn't say it's an absolute certainty. I think it's still incredibly still unlikely, but maybe 10%, 20% chance that you would get it. It wouldn't be gambling. This would be an educated guess. If you choose not to go, it's still considered an educated guess. I'm so scared of needles. Listen, these are perfectly valid things to say. The problem is it won't change the decision. And these things are not easy things to discuss publicly because everybody needs to understand what your limitations are, what you're willing to do, what you're not willing to do. But the advice is the advice. When you ask for general advice, then that's the advice. Go get evaluated and get the vaccine. Specifically, if somebody comes into my clinic and says, "Yo, Dr. Ashori, I don't want to get no damn shot, man. I don't want injections into my stomach, and I don't want the side effects, and I'm afraid of needles." Okay, we can talk about it. Here's your risk. Based on where you are, the current CDC risks in your area, the current rabies risks in your area, you have a risk of 30%, let's say. What do you want to do? If you get rabies, you're fucked, right? Do you want to get it? Do you not? Okay, great. Then don't get it. That's it. End of story. You make an informed decision together. I'll let you read the rest. It doesn't look interesting. I'll just skip it. I got slapped on the temple 10 times, and I'm wondering if I need to go to the hospital. Getting slapped on the temple does not require you to go to the hospital. It might require you to figure out who the hell slapped you. If you don't know that, 26-year-old female. Here we go. I just changed my mind. If you think you were in domestic violence, you should call the cops. Somebody slapped me over the head 10 times. Do I need to go to the hospital? It was between my eye and ear. Barely noticed bruising. Yeah, so it's just an odd question. You should go to the emergency. Hospital is the emergency room. You should go to the hospital when you think your life is in danger, when you have an emergency. And you should go to the urgent care when you think something urgent is going on that probably can't wait a couple of days. And you should make an appointment, like a routine appointment with your primary care doctor, when you can wait a few days to be seen. That's the way you should make your decision. If you got slapped and you passed out, yeah, you can get slapped hard enough that somebody can give you a concussion. You get a good open slap to the face. But getting slapped 10 times, probably not. What do we got? Was my 3-year-old SA'd? Let's see what SA is. He's 36 inches, 38 pounds, diagnosed autistic. Please help me. Was left alone with my stepfather by my mother on Wednesday night against my knowledge and permission. My stepfather was a peeper on me and did some light over the clothes sexual and inappropriate behavior. There's no such thing. There's no such thing as light over the clothes sexual and inappropriate behavior. You're either a inappropriate, sexual, mischievous criminal, or you're not. When I was a child, so yeah. What's SA? Shake your body? I don't understand. Mommy, help me. I don't know. I don't understand what SA is, but I can tell you that if you have a child and you left it with, if your child, against your knowledge, was left with someone else, first of all, remember that should Child Protective Services get involved, you are responsible, not anybody else. Doesn't matter if you let your mother, if you left your kid with your mother who then left your kid with somebody else. You are where the chain of command ends, and you will be held liable for anything bad that might happen. So be careful and be cautious, and remember that you're essentially responsible. You can't give up the control and protection of your child to anybody else. That's just the way the world works. That's just the way the world works. But if you are worried that something did happen to your 3-year-old child, I think the best thing is to just assess, is your child in good spirits, good shape, good health, any signs of trauma or anything like that. If there isn't, and of course, always feel free to take your child to a pediatrician to get checked out. It's probably okay to just kind of monitor it instead of maybe doing something bigger. But pretty sure if you had a stepfather who sexually molested you, that person should go to jail. I'm not saying they should go to jail. I should take that back. I'm not a big believer in everybody should just go to jail, but I think somebody like that is a criminal, and they should get help. They should receive help so that they don't engage in any other criminal activities that might hurt other people. And I think being anywhere near your stepfather is probably not a good idea. That's just another opinion that I have. Psychosis. In 18 days stay in the psychiatric care, all of my emotions are gone. I can no longer automatically breathe. We get a lot of questions like this. Usually people with mental health disorders, any kind of psychosis, psychiatric, schizophrenia, bipolar disorder, schizophreniform, schizoaffective, a lot of different type of medical conditions can, in the mental health field, can all show up with somebody suddenly not being able to feel something or feeling something weird, to have disconnected feelings. And all of that is unfortunately something that can happen to people. And there's not a lot you can do. Yourself in the moment. It's not an emergency per se, but as a patient, if you are somebody who, let's say you trust your doctor, let's say you have enough good faith in your doctor, you can discuss options. Like, hey, is this medication I'm taking really making me feel this way? Is there anything I can do to not feel this way? I'm tired of feeling this way. I want to try something different. Is it normal? Can somebody explain this to me? That would be helpful to do. But remember, the issue is when you are already dealing with these kind of emotional issues, it's unlikely that that patient is going to be able to properly express themselves to you as a doctor. And so this is where the doctor and the patient usually clash, and the doctor is just frustrated with the patient. There's not enough support and service available to these patients. So it becomes a pretty bad mess, unfortunately. If this person had somebody else kind of supporting them and being an advocate, then usually that would be good. Child is on day 5 of fever and I feel like I'm about to lose it. Please help me. As we always say, sometimes we need to treat the parents because oftentimes a lot of these infections can just take their course. And the parents are the ones who are like, man, my kid's like screaming and miserable and not sleeping and I'm going crazy. And we're like, well, I can give the kid an antibiotic or I can give you a Xanax. Both of them will result in the same outcome. And it's a joke. It's a joke. But what we're essentially trying to say is sometimes parents are at their wits' end and they want the doctor to intervene. But unfortunately, us intervening often, usually, almost always, causes a lot more complications. However, a 5-day fever, I know that's kind of a bit of a time. It's quite normal for some kids to have a week of a fever, especially assuming it's a 5-year-old or 6-year-old. And it'll be a low grade, it'll come, it'll go. And you give a little Tylenol or ibuprofen, and then you're kind of measuring it, but you're not really measuring it. The only way you can really measure a fever, by the way, is a rectal thermometer. That's for adults and kids. It's very, very accurate. The mouth ones, not accurate. Forehead, not accurate. Ear, not accurate. And not accurate as in, if it's 103 and 105 pretty consistently, you can definitely rely on that. If it's 101, 100 one time and then 98.7 another time, it could just be an error, unless you're doing a rectal, right? If you're doing a rectal, whatever number you get is pretty good, pretty accurate. Feel free to measure your rectal temperature, by the way, just to see where you're at, what your baseline is, because a lot of my patients always say, Doc, you don't understand, my baseline is 97.1. And that's true, actually. Some patients have a 97.1 basal body temperature. So my 6-year-old daughter has some kind of bug that is making our lives hell. I have major health anxiety when it comes to my kids, and it's to the point that I want to cry. I don't know what else to do. 6 foot, 6 feet, 6 years old, 6F, 6 female, 6-year-old female, 49 pounds. Started with an enlarged lymph node on the back of her skull. Posterior cervical chain, probably. Very low grade fever, complained of headaches, negative strep test. Her acting very under the weather. Acted very puny unless she had Tylenol, Motrin, complained about lights, noise, back of her head being sore. So it sounds like some sort of a headache and lymphadenopathy. So it could be mono, not common in that age group. I don't think it's meningitis. Could be a sinus infection, but not really posterior. That would be odd. Could be, lymphomas, leukemias in kids can present like this. Woke up crying, saying the noise hurts. Sensitivity with fever is very common. Everything, every sound, every smell, the skin will be super sensitive. She was taken to the ER, said F it, and took it to the ER. So taking a kid like this to the ER is actually going to create a lot more headaches for you and a lot more headaches for everybody else. This is not an emergency. Taking your kid to the ER just because you woke up in the middle of the night and you're like, damn it, I should have taken her earlier, but I didn't, is going to make the world a lot worse for you, because if that kid in the ER picks up something way worse, then you're going to be dealing with that. And if you pick up something way worse in the ER, you're going to be dealing with that. Remember, people go to the ER for leishmaniasis, tuberculosis, COVID, everything. So you want to avoid going to the ER if you don't need to. And also remember, the doctor seeing you in the emergency room is trained to manage really serious shit. So anything that comes into the door, they will always assume it's really serious shit until proven otherwise, and there's no way to prove otherwise. So you're going to get a lot of unnecessary tests and a lot of wrong, mistaken diagnoses, because that's the nature of what we call pretest probability. What is pretest probability? If somebody comes in to the ER doctor will assume this must have been an emergency. There's no other fucking reason why somebody would be in the ER. And if they come, that doctor will assume the worst. Every kid has meningitis and appendicitis until proven otherwise. Now you might say, but what about all those missed cases? Well, the problem is when a doctor sees a lot of normal stuff and they have to dismiss it constantly, they get into the habit of dismissing a lot of stuff back to back. So all of a sudden they'll see 15 kids, all of them with abdominal pain. None of them were emergencies. And then the last one, the 16th one, actually was a mild appendicitis, and they missed it because they just finished dismissing 15 people. And that's just the way the human mind works. Now, if only the people came who really had emergencies, it would be much less likely for that to happen. So Tylenol, Motrin, complained, went to the ER, tested negative for everything. And then kind of odd, right? The child has no symptoms, and then somehow somebody decided to do COVID, RSV, and flu test on him, which makes no sense. Because those chances are one of those would have turned out positive, and it would be a false positive because of pretest probability, because of Bayesian principles. The only thing they found was WBC in her urine. WBC is very normal in the urine, and prescribing an antibiotic, of course, as I just said, is a very bad thing to do when the kid doesn't really have an infection. But when you go to the ER, that's what you're going to get. Can a UTI cause these symptoms? Of course it can, absolutely. But you should get a urine culture. And if there was a UTI causing these symptoms, there certainly would be a lot more than just WBCs in the urine. When you say low-grade fever, what number are you getting when you measure her temp? About 100. Enough said. Well, and it continues. So I'll leave the rest for you guys to check out. That's it. If you have any questions, if you have any comments, suggestions, leave it below. Also check out digitalnomadhealth.com. Take care.